Welcome to Health Matters. My name is Sherri Gallant. I'm with Alberta Health Services. And to start our show off this time, we're talking with Andrea Claassen. She is a health promotion facilitator with Alberta Health Services. And Alberta Health Services is a member of the Community Interagency Suicide Prevention Council. And as such, we're going to be talking about World Suicide Prevention Day, which is coming up on September 10th. And if you see this program after September 10th, there's still some, I know that Andrea is going to give us some information that can be useful to you no matter what time you see it. Welcome, Andrea.
Thank you. So on September 10th, we are holding our Honoring World Suicide Prevention Day. It's a workshop. It is a free workshop to attend, so you can come down. It's at the downtown branch at the library in Lethbridge, and you can come attend this day and listen to some really great speakers that are going to be coming.
I've heard, well, I think we've talked about it in years past, but I know it's a pretty full day full of really helpful, interesting stuff.
It is. It starts at 10 in the morning and it goes till 4 o'clock. You're actually welcome to just come to one of the speakers if you want to. You can come for the full day. We do have registration this year, so it just kind of helps us to see how many people are going to be coming to attend the day. It's open to the public. It's open to agency members. It's open to different organizations, so anyone is welcome to attend and really listen to all these speakers that are going to provide information, education around suicide prevention, and just raise that community awareness.
That's awesome. So people don't have to worry that the information will be too high level for them. It's designed for everybody.
Exactly. It's not just for agencies, it's for everyone. So we've got some personal stories that are going to be told. There's information coming from professionals in the field, but it's open to anyone that really wants to come to that. We also have lunches provided for the day. It's free to attend the workshop, and we also have refreshments throughout the day that people can come and sit and enjoy that too, and really just connect with the community and connect with other agencies.
That's wonderful. Can you give us sort of a brief lineup of what's planned?
So each speaker talks for about 40 minutes, and so we do start at 10 o'clock. We just have a brief intro that's going to happen for the day, and then each speaker will talk. So we will provide a list of the speakers that you can take a look at and come for one of them, but we do have people telling their personal stories, as well as psychologists providing information in the field, and just other agency members as well that are going to provide their professional information as well.
Okay, and as I mentioned in the introduction, this show will run periodically past September 10th. So if someone is watching it after the event, is there any information you can give about hotlines or websites that might help people who are either suffering or know someone who may be at risk?
So our Community Interagency Suicide Prevention Council is made up of Alberta Health Services, Family Centre, Alberta Health Services Population Health, as well as addiction and mental health. So there is resources throughout the community, so you can always contact one of these centers, and we're able to provide you with that information and with that help that you would need regarding suicide prevention.
Okay, and maybe we'll put a number up on the screen for people as well. Thank you so much. This is awesome.
Thanks.
Welcome back. I'm here now with two women from the Chinook Arch Regional Library System. Charlene Fletcher is to my right, and Holly Otwell is to my left. I'm going to let them introduce themselves, and then we're going to talk about the wonderful programming that is available through this incredible organization. Hey, Charlene.
Thank you very much. I'm the Seniors and Intergenerational Program Developer for Chinook Arch Regional Library System.
Okay, so program developer is what sort of stuck with me in that big long title. What kinds of programs do you develop?
Well, we're doing seniors and intergenerational programming in the library. We received a grant last April for doing programming from the Aging Well in the communities from the Alberta government. So then I was tasked with developing programs that we could take to all 33 of our member libraries and have seniors and intergenerational children, is what we're mostly focusing on, have some playtime together, some story time, some interactions to develop some relationships within the communities.
Okay, can you talk about why it's important to do intergenerational programming?
Well, I think with our aging society, with having more seniors that will be coming up, that I don't think we honor our seniors like we need to in our communities. And I think children need that relationship to realize the importance that seniors have in our lives, the knowledge and the wisdom that they can share with us, and the fun they can still have with children and youth in their communities. And I think it brings them out of their homes. They're not lonely. They're interacting in their communities. And there's no better place than the library to bring communities together. And so I think it's just helps everyone feel better for their better well-being all around.
That sounds really wonderful to me, especially for, I mean, not every child has a grandparent, so
Yes.
they may not have access to
Right.
that senior population.
Yes.
Holly, as a library manager in a small community, relatively small community, can you tell me what you see the library's role to be in the community, and how this program supports that role?
Yeah, so in Claire's home, we have quite a large seniors population. In the library itself, I see people from all walks of life, and the library's kind of moved beyond being somewhere where you just go and browse quietly for books. You go in there to do basically anything from just meet your friends to learn anything new. With this intergenerational programming, we are allowing the seniors in our population to interact with the younger kids, which even though they share the library space, we rarely actually see them interacting. So this is a great program to get them started with that.
So it's almost like a community center, like a
Exactly.
meeting place, a place where people can get together, and then you facilitate things happening from there.
Exactly, yes. This program facilitates the interaction between the two age groups.
So Holly, is my information correct that you've held now one class of 7 that are planned?
Yes.
How did it go over? What did you hear back?
It went really well. I was in contact with the local senior center, and they're all very excited to join us. I find that there's an ability when you have young people interacting with seniors to reduce some of the negative stigmas that the groups can have towards each other, especially when you are in a library and you're sharing the space. The seniors can also be rather isolated, whether it's because their family is not close to them. So kids just kind of act as that great reminder that, you know, the world is more than your small little community, and learning things or even playing simple games, just simple interactions can really make a difference and improve your well-being.
And they probably look forward to what comes next.
Oh, exactly. We're very much looking forward to class number 2.
Charlene, tell us more about the 7 classes you'll be hosting and where they'll be.
Okay, well, I'm very excited. We just finished with class number 1, which was fun and games, which we had the seniors and the children come together and just play some fun games together, just kind of in a relaxed situation. And we just wanted to see relationships form naturally, which we did, and it was very fabulous. We really had a great time. Class 2 is starting in September, and we're doing art adventures. So we've got 3 great art projects planned I'm really excited about. And so we have some spin art, which will be lots of fun. And I know some librarians were a little worried about art in the library, but I have it all contained. So it'll be lots of fun. The 3rd class we're doing is we're going to be working with robots, which we're really excited about. And they're called Ozobots. And we're just excited to see seniors and children work together playing with robots and learning computer coding. And it will be lots of fun. Class 4, we're doing STEAM, which is science, technology, engineering, art, and math kits. So there will be a fun story for them to read and then activities for them to do after with the story involved. So you get the literacy and the math, and it's just lots of fun. And class number 5, we're doing kindness rocks. So we're learning about how being kind is important and rock painting and leaving them in our communities to be beautiful. Class number 6 is Orienteering, so we'll learn mapping with stars and have a treasure hunt in the library, which will be really fun. And our last class will be on storytelling and listening to our elders' stories, how they affect our lives, sharing our stories, and creating stories together.
I want to come to all of them.
You certainly can. We'd love to have you.
They sound terrific. So now that we've tantalized everybody with
Yes.
what you've got planned,
Yes.
how can they find out more about it and get involved?
Well, the best way is to go to your local library. Your librarians would be happy to help you. We also have ChinookArch.ca website, and if you go to About Us and click down, you'll find your member library, and you can look on there, and we have all the classes listed, and we have more than just intergenerational. There's so many things offered at your library. And also we're on Facebook and Instagram, so you can find us anywhere and find out what's going on.
Wonderful. Thanks to you both. Up next, we're going to talk with Arlene Moore, a registered dietitian with Alberta Health Services, and she's going to give us some information on how to use Canada's new food guide in new and different ways. Stay tuned. And welcome back. Now I'm talking with Arlene Moore. Arlene is a registered dietitian with Alberta Health Services, and she's going to tell us what the new food guide, Canada's new food guide, which is called Eat Well, Live Well, what advice it can give us about the benefits of eating with others. Welcome, Arlene.
Thank you. I'm glad to be here.
I'm glad to have you with us. You always have such great information. Health Canada released the Canada's new food guide earlier this year, and one of the recommendations is eating meals with others as a beneficial part of healthy eating. Can you expand on that?
Yes, that's right. Eating meals with others is a beneficial part of healthy eating. When you share meals and come together and enjoy meals, you create memorable times, you come together, you share different foods, and it's just quality time together.
Okay, and so, some people might be listening to this and they'll say, we just don't have time. We've got soccer practice, we've got brownies, we've got dance, we've got skating. We grab something on the run, and we're lucky if we eat before we come home at 9 o'clock. What do you say to those people who say they're too busy?
You're absolutely right. There's a lot of people who have busy schedules, and it can be tough sometimes, but if we really want to think about it, the key is to making a plan. So you might want to approach a coworker and have a meal together, or plan to have regular meals with your families and your friends, dinner meals, that kind of thing together, where you come together and you really enjoy. You can also join in community events where they're revolving around meals, or start one in your own neighborhood, or host a potluck. And potluck, you reduce the load among many, so sometimes that helps make it happen.
That's true. Spread the work out, spread the love out.
Right.
It sounds like sharing meals with others can offer lots of benefits. But we don't have to think of it necessarily just in terms of our family. As you mentioned, coworkers and potlucks, eating with others can be anybody, right?
That's right, and we're social beings, and that's one of the great benefits is the socialization around food. Some other benefits are parents get to model healthy eating to their kids. Kids get to come together and eat healthy foods. There's also the communication aspect, where there's lots of great conversation that can happen around the table, and just trying new foods, including cultural foods.
Potluck, back to potluck, sounds like an interesting and fun way to share a meal. Can you offer some tips for holding a successful potluck?
Yeah, I would suggest that when you do hold a potluck, consider that your guests may have some diet concerns or some food allergies, and find that out from those that you're inviting. And if someone does, then let the others know what food items might need to be avoided at the potluck. Also, you want to consider being sure that your food is safe. Before the potluck, only take the food out of the fridge just before you're ready to eat, and once the meal's over, place those food items back in the fridge right away. Keep hot food hot by using a crock pot or some electric item that holds food hot. Mm-hmm. And as well, make sure that foods like meat, poultry, eggs, seafood are not kept at room temperature for more than 1 to 2 hours. And if you want to know more about some healthy recipes or you want to learn more about tips for hosting healthy potlucks, try going to the Healthy Eating Starts Here website.
And we'll put that up on the screen for our viewers just to give them that information.
Thank you.
You know, I remember hearing some of this stuff from my mother. She said, "Don't ever leave potato salad out in the sun." Why does that become dangerous?
Well, there's the mayonnaise in the potato salad, and at the wrong temperatures, pathogens can start to grow, and you can run a risk around food safety.
And the other thing, I think, which is an old way of thinking, and you mentioned put it right back in the fridge, but I think the older way of thinking used to be let it cool down before you put it in the fridge, but that's not a good idea.
I think it's best to get it in the fridge at the right temperature, especially on those hot days.
Okay, good information. Do you have any additional information as to how to host a great potluck?
Oh, I do, because potlucks can be so much fun, and so you might want to plan some activities around it, such as trivia game or scavenger hunt. You want to come together, shut those screens off, close off your phones, and reconnect in conversation. Play a game, or I should maybe call it a sport, such as badminton or volleyball, and just come together, laugh, play, and create those kind of memories that will last a lifetime.
And burn off some of the calories you just had from your potluck.
Why not, hey? What a great idea.
Thanks again, Arlene. It's always a pleasure. And stay tuned for our next segment. We're going to be speaking with Trish York from the Heart and Stroke Foundation with some information about stroke. Welcome back. Thanks for being with us. I'm here with Trish York. Trish is a coordinator of community engagement in Southern Alberta with the Heart and Stroke Foundation. Welcome, Trish.
Thank you very much, Sherri. I appreciate being here.
It's good to see you. Trish is based in Lethbridge but covers a lot of ground in her work, and she's here to tell us the basics about stroke, because you may not know what the signs are. First, how do you define it? What is a stroke?
Certainly. A stroke happens when blood flow stops to the brain or bleeding occurs in the brain, leading to the death of on average 1.9 million brain cells per minute. The effects of a stroke depend on the part of the brain that was damaged and the amount of damage done. The brain is responsible for everything that we do, think, feel, and say, how we move, react, and interact with others. So you can see why stroke is a very important health issue here in Canada.
How common are strokes, and what is the effect of strokes on Canadians?
Very good question. Stroke is the third leading cause of death in Canada. 62,000 strokes happen in Canada every year, and about 13 of those are here in Alberta every day. Strokes are devastating. Most people in Canada who have a stroke will survive. However, 60% or so will live with some degree of disability that can impact simple daily activities like eating, bathing, dressing, and just simply moving around.
So we're going to talk today about Heart and Stroke's F.A.S.T campaign.
Certainly.
What is it all about? What does it mean?
Okay, absolutely. Great question, because F.A.S.T is a campaign that we started a couple of years ago. The Heart and Stroke Foundation here in Canada wanted a very simple, easy way for people to recognize the signs of stroke. And that could be children could recognize these signs, adults, anyone. So the acronym is F.A.S.T. F stands for face. Is it drooping? A stands for arms. Ask them to lift both arms. If one of them, they can't hold up both arms, one droops, then that could be a sign of a stroke. S is for speech. Is it slurred or is it mumbly? And T is for time. We recognize with 1.9 million brain cells on average dying in a stroke per minute how truly important it is to get that person to the hospital as soon as possible. So F.A.S.T, it's a pretty easy acronym for most people to remember.
Mm-hmm, it is. Now, what if something is happening, you can see that something is happening with someone, but they maybe only have one of those symptoms. Could it still be a stroke?
Absolutely. Even if it's just one of those, it's better to err on the side of the caution and get that person to the hospital to get the proper treatment. You increase their odds of recovery from that stroke. But yes, it could come on as blurred vision or a sudden headache. So even if there's just one of those symptoms from the F.A.S.T campaign, please do get that person to the hospital as soon as possible.
And those are fairly significant symptoms. They're not something that would just happen every day.
Absolutely, right.
You would notice. When we talk about learning the signs of a stroke, who do you want to learn this information?
We want everyone to learn the signs of stroke. Even students in schools can learn them. So a part of my work with the Heart and Stroke Foundation here throughout all of Southern Alberta is I travel to the schools and do kickoff assemblies and health presentations to students in predominantly elementary schools. And this year, that really was a large part of our work, was making sure that kids learned the signs of stroke. We actually have a beautiful story out of Calgary, a true story, where a little 8-year-old boy was in his elementary school and learned about the signs of stroke, and then in 5 days later, his dad was having a stroke. His dad's with a firefighter with the Calgary Firefighters Association, and his little boy was able to phone 911 and help save his dad's life. And we have that story to show you actually right now.
911, what is your emergency? Can you lift both arms above your head?
Yep.
Do any of them feel lower than the other?
My left one feels really weak.
Okay, and you say the early bird catches the worm?
Move the phone for a second. Now, Dad, lift your both of your arms up for as long as you can. Okay, good. Can you smile away to this? Okay, so he's kind of having a stroke.
How does he know to do all that?
At school.
Hello, my name is Maxwell Scott Pozo. I am 8 years old. He grabbed a glass cup, right side just too easy, left side he couldn't even lift it. And then I realized, well, okay, my dad's probably, I think it's more serious than I thought. I remembered all those things a couple days ago from Jump Rope for Heart, so that's when I decided it's a stroke. F, it stands for face, so if one side's up or one side's down, that's an indicator of a stroke. A, if one arm can stay up longer than the other, that's a sign of a stroke as well. S, speech, if it's mumbling. And now, T, listen carefully and remember this always. T is for time of calling 911.
Wow, what an amazing story. Trish, do you think the FAST campaign, I mean, this seems to be evidence that it's working. Do you think it's working?
Absolutely, it's working. I think that video just truly shows that students are learning in the schools that we travel to with our work with the Heart and Stroke Foundation. They're listening, and for that little boy to be able to help save his dad's life and know the signs of stroke from that FAST acronym was amazing to all of us that do our work with the Heart and Stroke Foundation. So yes, very important that we all know that, because you never know if you could be at a grocery store, you could be anywhere and might see those signs, and you would be able to help somebody that's having a stroke and get them taken care of.
Incredible. Where can people go to learn more?
Thank you. We have a website, heartandstroke.ca, and we encourage everyone to visit our website. We have something for everyone on stroke, also, of course, to do with all of the issues with heart disease here in Canada. We have wonderful healthy recipes because we really, truly know that it's very important to do all the right things for your health, to be proactive about your health, eat healthy, exercise, be smoke-free, keep an eye on your blood pressure, and stay hydrated. Really, do all the right things to look after your health. So, www.heartandstroke.ca. And finally, regarding my work here in Southern Alberta, I'd like to thank all the really wonderful volunteers that help us during February, which is Heart Month, and that help us out in June, which is Stroke Month, to bring awareness to heart disease and stroke here and how that affects us directly in Southern Alberta, and that I'm very grateful to do the work that I do, traveling throughout Southern Alberta to Medicine Hat, to Brooks, to Crow's Nest Pass here in Lethbridge, and all the wonderful schools that welcome me into their schools to teach kids about things like FAST and all the things that we can all be doing to be healthy.
I'd like to say thank you to all my guests today. They, as usual, bring us a wealth of information. Thank you for watching AHS Health Matters. I'm Sherri Gallant, and we hope to see you next time.